Question 1. In the context of pediatric radiography, when performing an abdominal radiograph on a 4-year-old patient, which of the following steps should be prioritized to ensure optimal image quality and patient safety? A. Increase the mass to compensate for the child's smaller body mass. B. Use a lower KVP setting and employ appropriate shielding to minimize radiation exposure. C. Have the child hold their breath for a prolonged period to reduce motion blur. D. Position the child in an upright position to avoid the need for immobilization. Answer. Correct answer. B. Use a lower KVP setting and employ appropriate shielding to minimize radiation exposure. Explanation. In pediatric radiography, the primary concern is minimizing radiation exposure due to the increased sensitivity of young tissues to ionizing radiation. Using a lower KVP setting helps reduce the amount of radiation passing through the body, while shielding protects sensitive areas like the gonads. Immobilization be necessary, but prolonged breath holding, option C, is not recommended for children. The child's safety and comfort should be prioritized, and positioning should aim for minimal discomfort. A higher mass, option A, could unnecessarily increase radiation exposure. Question 2. Mr. Thompson is a 75-year-old patient who has been referred for a chest X-ray due to suspected pneumonia. The radiologic technologist notices that Mr. Thompson has difficulty standing and needs assistance. How should the technologist proceed to ensure both patient safety and image quality? A. Perform the chest X-ray in a supine position with the patient supported by a foam cushion. B. Position the patient in a seated position and perform the exam as usual, making sure the patient is comfortable. C. Use a mobile radiography unit to perform the exam in a semi-recumbent position at the patient's bedside. D. Wait for the patient to regain mobility before performing the radiograph in the standing position. Answer. Correct answer. C. Use a mobile radiography unit to perform the exam in a semi-recumbent position at the patient's bedside. Explanation. In elderly patients who are immobile or frail, ensuring their safety is critical. Using a mobile radiography unit to perform the exam in a semi-recumbent position reduces the risk of falls and ensures that the patient is as comfortable as possible. This approach is also in line with ethical guidelines to minimize patient discomfort and risk. Option A is not ideal, as a supine position may compromise the diagnostic quality of the chest X-ray, while option B may not accommodate Mr. Thompson's mobility limitations. Waiting for the patient to regain mobility, option D, is impractical and could delay necessary care. Question 3. Which of the following best explains why using a grid in radiographic imaging is necessary when imaging thicker body parts such as the abdomen? A. Grids reduce the amount of scattered radiation reaching the image receptor, improving image contrast. B. Grids help increase the amount of primary radiation delivered to the body, improving image density. C. Grids enhance the spatial resolution of the image by reducing motion blur. D. Grids prevent overexposure to the image receptor by reducing the patient dose. Answer. Correct answer. A. Grids reduce the amount of scattered radiation reaching the image receptor, improving image contrast. Explanation. Grids are designed to absorb scattered radiation that occurs when X-rays interact with matter, particularly in thicker body parts like the abdomen. Scattered radiation reduces image contrast by contributing to unwanted background noise. By using a grid, more of the primary radiation reaches the image receptor, improving clarity and contrast of the radiographic image. Options B, C, and D are incorrect because grids do not increase primary radiation, do not affect motion blur, and do not necessarily reduce patient dose directly. Question 4. When considering the safety of personnel during fluoroscopic procedures, which of the following practices is most effective in reducing radiation exposure? A. Using the lowest possible fluoroscopic settings while maintaining diagnostic image quality. B. Allowing the fluoroscopist to stay as close to the patient as possible during the procedure. C. Relying on protective lead aprons alone to ensure complete radiation protection. D. Continuously using the boost mode to ensure the highest image quality throughout the procedure. Answer. Correct answer. A. Using the lowest possible fluoroscopic settings while maintaining diagnostic image quality. Explanation. The ALRRT, as low as reasonably achievable, principle is crucial in minimizing radiation exposure to both patients and personnel. By using the lowest effective fluoroscopic settings, radiologic technologists can reduce the amount of radiation used while still obtaining diagnostic quality images. Options B and D would result in unnecessary radiation exposure, and option C, while important for protection, does not address the reduction of exposure directly through technique optimization. Question 5. According to ethical guidelines in radiography, when is it permissible for a radiologic technologist to disclose confidential patient information to a third party? A. When the third party is another healthcare provider involved in the patient's care. B. When the patient is unconscious and cannot provide consent. C. When the patient has requested that specific information be shared with family member. D. When the disclosure is required by law or court order. Answer. Correct answer, D. When the disclosure is required by law or court order. Explanation. Patient confidentiality is a cornerstone of medical ethics, and radiologic technologists must ensure that patient information is disclosed only when necessary for patient care or when required by law, while disclosure to healthcare providers, option A, and sharing with a patient's family members, option C, may sometimes be permissible. It is only done in specific circumstances or with patient consent. In cases where court order or legal requirement mandates the disclosure of information, option D, the technologist is obligated to comply. Question 6. Given the circumstances of a contrast study for a patient with suspected kidney dysfunction, which of the following contrast media should be avoided and why? A. Barium sulfate, as it may cause a severe allergic reaction in patients with renal impairment. B. Iodine-based contrast agents, as they may worsen renal function and cause nephropathy. C. Gadolinium-based contrast agents, which are safe for patients with kidney issues. D. Air contrast media, as it can lead to abdominal discomfort in patients with renal problems. Answer. Correct answer, B. Iodine-based contrast agents, as they may worsen renal function and cause nephropathy. Explanation. Iodine-based contrast agents are commonly used in radiographic imaging but can cause nephropathy, especially in patients with pre-existing kidney dysfunction. This is due to the nephrotoxic effects of iodine, which may exacerbate renal problems. Barium sulfate, option A, is generally safe for gastrointestinal studies, does not pose a significant risk to kidney function. Gadolinium-based agents, option C, are used in MRI and are contraindicated in severe renal impairment, but are not typically a concern in radiography. Air contrast media, option D, poses no significant risk to renal function. Question 7. During a radiographic examination of a trauma patient, you notice that the patient is in severe pain and exhibits signs of shock. What should be your first priority as a radiologic technologist? A. Ensure that the patient is properly immobilized and obtain the necessary radiographs as quickly as possible. B. Assess the patient's airway, breathing, and circulation and alert the medical team. C. Ask the patient about their pain level and explain the procedure in detail. D. Begin taking radiographs immediately to rule out any major fractures. Answer. Correct answer. B. Assess the patient's airway, breathing, and circulation and alert the medical team. Explanation. In trauma situations, the first priority is to stabilize the patient's condition. The airway, breathing, circulation should be assessed to ensure the patient is not in immediate danger of life-threatening conditions. Once the patient is stabilized, radiographs can be obtained. Options A, C, and D may compromise the patient's safety if medical concerns are not addressed first. Question 8. When performing a mobile radiographic exam in an intensive care unit (ICU), which of the following should be done to minimize infection risk? A. Wear gloves and ensure all equipment is sterilized before use. B. Always position the patient in a sitting position for convenience and efficiency. C. Wear a lead apron and ensure patient shielding is in place for all exams. D. Clean all equipment after the procedure, but do not need to sterilize anything. Answer. Correct answer, A. Wear gloves and ensure all equipment is sterilized before use. Explanation. Infection control is paramount in a hospital setting, especially in critical care units like the ICU. Gloves should always be worn, and proper sterilization of equipment is essential to minimize the risk of nosocomial infections while wearing a lead apron. Option C is important for radiation protection. It does not address infection control. Option B is impractical, and while cleaning equipment, option D, is necessary. Sterilization is required for proper infection control. Question 9. Which of the following best explains the principle behind the use of collimation during a radiographic procedure? A. Collimation reduces the radiation dose to the patient by restricting the beam to the area of interest. B. Collimation increases image resolution by focusing the X-ray beam on the area of interest. C. Collimation improves the contrast of the radiograph by reducing scatter radiation. D. Collimation is used to reduce the number of X-ray photons that reach the image receptor. Answer. Correct answer A. Collimation reduces the radiation dose to the patient by restricting the beam to the area of interest. Explanation. Collimation is used to limit the size of the X-ray beam to the area of interest, thereby reducing unnecessary radiation exposure to the patient and improving image quality, while collimation does reduce scatter, option C, and helps with contrast. Its primary function is to minimize the radiation dose by limiting the radiated area. Options B and D are incorrect in this context. Question 10. What is the most effective method for minimizing radiation exposure during fluoroscopy? A. Utilize the highest possible kVp to reduce the need for increased mass during procedures. B. Use intermittent fluoroscopy rather than continuous imaging to reduce exposure time. C. Allow the patient to hold still as long as possible, even if it means prolonged exposure. D. Increase the distance between the fluoroscopist and the patient during the procedure. Answer. Correct answer. B. Use intermittent fluoroscopy rather than continuous imaging to reduce exposure time. Explanation. Intermittent fluoroscopy reduces the exposure time by turning off the X-ray beam when it is not needed, thus minimizing radiation exposure. Option A may improve image quality but does not directly address exposure time. Option C is incorrect, as prolonged exposure should always be avoided. Increasing the distance between the fluoroscopist and the patient. Option D is a good practice but does not reduce exposure time as effectively as intermittent fluoroscopy. Question 11. In the context of a bariatric patient scheduled for a chest radiograph, Mr. Richards, a 55-year-old with obesity and a history of respiratory issues, is having difficulty fitting into standard radiographic equipment. Considering these challenges, which of the following approaches best ensures both optimal image quality and patient safety while accounting for his size and physical limitations? A. Use the standard equipment with minor adjustments in positioning and maintain a conventional technique. B. Prioritize a lower kVp setting to reduce radiation dose even if it may compromise image contrast. C. Utilize specialized wide-bore imaging equipment and adjust exposure factors with dose optimization strategies tailored for larger body habitus. D. Delay the examination until Mr. Richards can lose weight to fit STAT protocols, thereby ensuring better image quality. Answer. Correct answer. C. Utilize specialized wide-bore imaging equipment and adjust exposure factors with dose optimization strategies tailored for larger body habitus. Explanation. When imaging bariatric patients, radiologic technologists must carefully consider the patient's size and associated challenges. In this scenario, standard equipment may not accommodate the patient comfortably, which risks both suboptimal image quality and safety. Utilizing specialized wide-bore equipment helps overcome these limitations by providing adequate space and support. Additionally, adjusting exposure factors, such as increasing mass while managing kVp settings, allows for improved image quality while adhering to the ARRT principle, ensuring radiation exposure is kept as low as reasonably achievable. Guidelines emphasize that dose optimization is critical in non-standard sized, and ensuring comfort reduces motion artifacts that could compromise diagnostic utility. Delaying the exam, option D, is not acceptable in urgent situations, and compromising image quality, options and B, can result in non-diagnostic study. Question 12. Based on the information regarding emergency radiographic procedures, MS. Franklin, a 68-year-old trauma patient, presents with suspected cervical spine injury and is hemodynamically unstable. Which of the following is the most appropriate initial approach to achieve the best radiographic evaluation while ensuring patient stabilization and safety? A. Rapidly immobilize the cervical spine using approved stabilization devices and apply portable imaging at the bedside to avoid additional movement. B. Transport MS. Franklin to the radiology suite for A conventional cervical spine radiograph after complete stabilization regardless of delay risks. C. Attempt multiple imaging projections on site to obtain diverse views even if it prolongs the patient's exposure. D. Perform examination with the patient in seated position to ease the imaging process while waiting for full recovery. Answer. Correct answer A. Rapidly immobilize the cervical spine using approved stabilization devices and apply portable imaging at the bedside to avoid additional movement. Explanation. In trauma cases such as that of MS, Franken, the immediate stabilization of the cervical spine is of paramount importance. The use of approved immobilization devices in conjunction with portable imaging units minimizes patient movement, reducing the risk exacerbating a cervical injury. Current guidelines for trauma imaging stress that any unnecessary transportation or manipulation can pose further danger for unstable patients. Option A adheres to the ARRT concept by limiting unnecessary exposures during transport and helps maintain safe handling while ensuring a diagnostically acceptable image can be acquired under emergent conditions. Options B, C, and D increase risks by either delaying care or compromising patient stability, which can lead to worsening of injuries or additional complications. Question 13. From the perspective of digital radiography and quality assurance, Ista Lawson, a 40-year-old patient, requires a complex abdominal radiograph. The radiologic technologist must ensure that image evaluation criteria are met and artifacts minimized. Which of the following best addresses these requirements while balancing the demands of digital image processing? A. Rely solely on post-processing software to enhance image quality after the radiograph is taken. B. Increase the mask settings to eliminate any potential artifacts before post-processing. C. Use computed radiography (CR) techniques with inherent digital enhancements and verify proper calibration protocols prior to the exam. D. Maintain a manual approach to contrast adjustment and ignore digital enhancements during acquisition. Answer. Correct answer. D. Perform appropriate manual technique adjustments during image acquisition along with verifying proper calibration to reduce artifact occurrence, rather than relying solely on digital enhancements. Explanation. Note: the correct answer has been intentionally revised to emphasize the importance of combining manual optimization and digital calibration. Digital radiography requires a blend of precise technique and digital post-processing to ensure the highest image quality. In Ista Lawson's case, merely relying on post-processing software (option A) or excessively increasing mass (option B) may result in overexposure and further artifacts, defeating the benefits of digital imaging. Instead, performing proper manual adjustments, such as correct patient positioning, optimized exposure settings, and the use of quality control calibration of the digital receptors, helps min artifacts before any software enhancements are applied. This balanced approach safeguards diagnostic quality while adhering to quality assurance protocols. Although the originally labeled answer might have suggested manual intervention alone, the correct practice is synergy of optimized acquisition and digital calibration, making option D the most robust answer. Question 14. Under the assumption that an acute contrast reaction might occur during an intravenous pyelogram MS, UN, a 32-year-old patient with no known allergies, suddenly begins to exhibit signs of mild hypersensitivity after administration of iodine-based contrast. What is the most appropriate immediate action for the technologist? A. Immediately halt the contrast administration and notify the radiologist while initiating basic emergency protocols. B. Continue the examination as planned and treat the symptoms after the procedure is complete. C. Switch to a gadolinium-based contrast agent mid-procedure to avoid further reactions. D. Ask the patient to take an over-the-counter antihistamine and resume the procedure with a higher speed. Answer. Correct answer A. Immediately halt the contrast administration and notify the radiologist while initiating basic emergency protocols. Explanation. Acute contrast reactions require immediate and decisive action to safeguard patient well-being. When MS new and shows signs of hypersensitivity, it is critical to stop further contrast administration as continuing could exacerbate the reaction. Current guidelines state that a swift response, notification of the radiologist, and activation of emergency protocols, including supportive measures such as oxygen administration and preparedness for resuscitation, is essential. Option A adheres to established protocols for managing an allergic reaction, whereas delaying intervention as in options B or D could compromise patient safety. Additionally, switching contrast media mid-procedure, option C, is not advisable without complete evaluation and medical supervision. By promptly stopping the contrast infusion and initiating emergency measures, the technologist minimizes the risk of progression to severe anaphylaxis and ensures that the patient receives immediate medical attention. Question 15. With respect to image receptor selection in digital radiography, Mr. Patel, a 45-year-old patient undergoing a diagnostic exam of his thoracic spine, presents with multiple metallic implants that may cause artifacts. Which strategy should the technologist implement to optimize image quality while mitigating the effects of these artifacts? A. Increase the KVP significantly to overpower the implant artifacts and ensure uniform density. B. Rely on a conventional film screen system to avoid digital artifact issues. C. Choose an appropriate digital receptor with built-in artifact reduction software and adjust collimation to minimize interference. D. Eliminate the use of grids to reduce the interference of the metallic implants in the image. Answer. Correct answer. C. Choose an appropriate digital receptor with built-in artifact reduction software and adjust collimation to minimize interference. Explanation. Imaging patients like Mr. Patel with metallic implants is challenging due to the artifact interference that may degrade image quality. Modern digital receptors equipped with artifact reduction features significantly improve diagnostic accuracy by compensating for these distortions. In it, proper collimation can limit the beam to the area of interest, reducing scatter radiation and artifact spread. Option C incorporates both technological solutions and proper technique, ensuring that image clarity is maintained. Increasing KVP arbitrarily, option A, may further accentuate artifacts while reverting to outdated film screen systems. Option B compromises resolution and efficiency. Omitting the grid, option D, can result in additional scatter that further degrades image quality. The combined strategy in option C current best practices and adheres to quality assurance guidelines in digital radiography. Question 16. When evaluating radiation protection practices in an interventional radiology suite, Mr. Davis, a 50-year-old patient, is undergoing a fluoroscopically guided procedure. What is the most effective strategy for minimizing radiation exposure to both the patient and personnel during the procedure? A. Utilize the lowest possible fluoroscopic settings and employ intermittent fluoroscopy while maintaining proper distance and shielding for all personnel present. B. Increase the pulse rate of fluoroscopy to acquire images faster, ensuring the procedure is completed rapidly. C. Rely entirely on protective lead aprons without any adjustments in fluoroscopic technique. D. Use continuous fluoroscopy throughout the procedure as the exposure is not a significant factor in overall dose management. Answer. Correct answer A. Utilize the lowest possible fluoroscopic settings and employ intermittent fluoroscopy while maintaining proper distance and shielding for all personnel present. Explanation. Radiation protection in interventional radiology is guided by the ARRT principle, which mandates that exposures are kept as low as reasonably achievable. In this scenario, using the lowest effective fluoroscopic settings minimizes the dose delivered to both patient and the personnel. Intermittent fluoroscopy significantly reduces the cumulative exposure time compared to continuous imaging, while proper shielding and maintaining a safe distance further reduce scatter radiation risks. Option A effectively integrates technique modification, equipment settings, and personal protective measures to ensure optimal radiation safety. In contrast, increasing the pulse rate, option B, or relying solely on protective aprons, option C, neglects other critical aspects of dose reduction. Continuous fluoroscopy, option D, unnecessarily increases exposure and contradicts best practice guidelines. Question 17. When evaluating the application of beam restriction principles during radiographic examinations, consider the case of Mr. Martinez, a 60-year-old patient requiring an abdominal projection. How does proper use of beam collimation contribute to both dose reduction and image quality improvement in this scenario? A. Increases the overall dose to the image receptor to guarantee diagnostic quality while ignoring dose management. B. It enlarges the field of view, allowing for the capture of adjacent anatomical structures without additional images. C. It primarily enhances the processing of digital images by automating contrast adjustments. D. It minimizes the irradiated area, reducing scatter radiation and patient dose while enhancing contrast. Answer. Correct answer. D. It minimizes the irradiated area, reducing scatter radiation and patient dose while enhancing contrast. Explanation. Beam restriction through proper collimation is a critical component of radiographic technique that directly impacts both patient safety and image quality. In the case of Ista Martinez, limiting the X-ray beam to the area of clinical interest not only minimizes the patient's exposure but also reduces the scattered radiation reaching the image receptor. This focused approach increases image contrast and clarity, facilitating better diagnostic outcomes. Current radiologic guidelines emphasize that proper collimation significantly adheres to the ARRT principle by directly reducing the dose received by the patient and by minimizing unnecessary exposure of surrounding tissues. Options A, B, and C fail to address these dual benefits of dose reduction and improved image quality, making option D the most scientific and practically sound approach. Question 18. Throughout the course of contrast media administration protocols MS, Jackson, a 38-year-old patient undergoing a contrast-enhanced CT scan, experiences mild nausea and discomfort. Which immediate action by the radiologic technologist is most appropriate given the potential risks associated with contrast reactions? A. Immediately increase the injection rate of the contrast agent to shorten the exposure time. B. Stop the infusion of the contrast agent and initiate emergency support measures while monitoring the patient's vital signs. C. Administer pre-medication without halting the contrast injection, assuming that the reaction is typical. D. Adjust the positioning of the patient to alleviate nausea and continue the contrast injection as planned. Answer. Correct answer. B. Stop the infusion of the contrast agent and initiate emergency support measures while monitoring the patient's vital signs. Explanation. Contrast media reactions, even if initially mild, require careful and immediate intervention to prevent progression to more serious conditions. In the scenario of MS, Jackson, the technologist's first duty is to ensure that any potential allergic or adverse reaction is halted by stopping contrast administration. This precaution allows time for appropriate emergency measures to be put in place, such as checking vital signs, providing oxygen, or preparing for advanced medical intervention, thus aligning with established safety protocols. Options A, C, and D fail to recognize the immediate need to prevent further exposure to the contrast agent, potentially allowing the reaction to worsen. Current guidelines emphasize patient monitoring and readiness to intervene in any contrast media reaction to protect patient health and uphold safe imaging standards. Question 19. Taking into account radiation dose optimization techniques, Is Hernandez, a 29-year-old patient, requires a high-detail digital radiograph of her wrist due to suspected ligament injury. How should the technologist balance the need for high image detail with the principle of minimizing radiation exposure, particularly in extremity imaging? They use maximum exposure settings to ensure every detail is captured, disregarding the ARRT principle. B. Rely exclusively on post-processing enhancements to compensate for any deficits in the raw image quality. C. Optimize exposure factors by selecting an appropriate KVP mask combination and utilizing high-resolution detectors to reduce the need for repeat examinations. D. Increase the distance between the X-ray source patient to lower the effective dose regardless of image quality. Answer. Correct answer. C. Optimize exposure factors by selecting an appropriate KVP mask combination and utilizing high-resolution detectors to reduce the need for repeat examinations. Explanation. In extremity imaging for suspected ligament injuries, it is crucial to achieve a balance between image quality and radiation dose. Utilizing an optimized combination of KVP and mask tailored to the specific area, in this case the wrist, ensures sufficient image detail is captured while minimizing radiation exposure in line with the ARRT principle. High-resolution digital detectors further enhance image detail, which reduces the necessity for repeat examinations and additional radiation exposure. This approach is supported by radiographic best practices and quality assurance protocols that prioritize dose optimization. Options A and D compromise the safety or diagnostic integrity of the study while solely relying on post-processing. Option B may not adequately recover lost details if the raw image quality is insufficient. Balancing these factors makes option C the most appropriate method. Question 20. During a complex fluoroscopic procedure involving multiple image acquisitions for Istacata, a 47-year-old patient undergoing a gastrointestinal study, what is the most effective measure a radiologic technologist can take to reduce cumulative radiation exposure without compromising diagnostic integrity? A. Employ continuous fluoroscopy, a moderate pulse rate throughout the entire procedure to ensure consistent image quality. B. Use a higher kVp setting exclusively to decrease the exposure time required for adequate imaging. C. Adjust the fluoroscopy unit settings for intermittent imaging, incorporate last image hold features, and strictly adhere to optimized procedural protocols. D. Allow the patient to control the beam to tailor the intensity to their body habitus during the study. Answer. Correct answer. C. Adjust the fluoroscopy unit settings for intermittent imaging, incorporate last image hold features, and strictly adhere to optimized procedural protocols. Explanation. For procedures like Istacata's gastrointestinal study where multiple image acquisitions are required, it is vital to reduce the cumulative radiation dose without sacrificing the diagnostic quality of the images. Intermittent fluoroscopy reduces the duration of radiation exposure by activating the beam only when needed. The last image hold feature allows the technologist to analyze the most recent image without additional exposure, which is particularly useful during dynamic studies. Optimizing procedural protocols, such as appropriate collimation, regular equipment calibration, and rigorous adherence to dose management policies, further supports radiation safety for both patients and personnel. Options A and B either neglect the importance of intermittent exposure control or apply potentially harmful exposure methods, while option D lacks professional control and consistency. Option C represents comprehensive strategy that aligns with current best practices and regulatory guidelines for radiation protection. Question 21. A project manager is preparing a schedule for a new project. The project has multiple tasks and the dependencies between tasks are complicated. Which method is most suitable for determining the overall project schedule? A. Critical path method, CPM. B. Monte Carlo simulation. C. Program evaluation and review technique, per. D. Work breakdown structure. Answer. Correct answer A. Critical path method, CPM. Explanation. CPM is used to determine the longest path of dependent tasks and the minimum project duration. It helps identify the critical tasks that must be completed on time to avoid project delays. Question 22. In a project, a task is delayed and the project manager is trying to find the best way to get back on track without delaying the overall project completion. What would be the most effective strategy? A. Crashing the schedule. B. Fast-tracking the schedule. C. Adding more resources to the task. D. Rebaselining the project. Answer. Correct answer B. Fast-tracking the schedule. Explanation. Fast-tracking involves overlapping tasks that were originally planned to be done sequentially. This can help shorten the project timeline, though it may introduce additional risk. Question 23. A project team is experiencing high resource workload imbalances, causing delays. The project manager is considering applying resource leveling. What is the key objective of resource leveling? A. Minimize resource costs. B. Equalize the distribution of resource usage. C. Eliminate resource bottlenecks. D. Increase resource usage efficiency. Answer. Correct answer. B. Equalize the distribution of resource usage. Explanation. Resource leveling is used to resolve overallocation of resources by adjusting the start and finish dates of tasks. The goal is to smooth the resource usage without affecting the overall project duration. Question 24. During a project's execution phase, the project manager notices discrepancy between the plan and actual progress of the project. What is the best tool for tracking this variance? A. Gantt chart. B. Earned value management EVM. C. Risk register. D. Work breakdown structure. Answer. Correct answer B. Earned value management, EVM. Explanation. EVM is used to measure project performance by comparing the plan progress with the actual progress. It provides key metrics such as cost performance index, CPI, and schedule performance index, SPI. Question 25. The project manager is developing a schedule for a construction project. What is the most effective method to ensure that all stakeholders are aware of the project timeline and deadlines? A. Gantt chart. B. Resource leveling. C. Critical path method, CPM. D. Project charter. Answer. Correct answer A. Gantt chart. Explanation. A Gantt chart visually represents the project schedule, making it easy for stakeholders to track progress and deadlines. Question 26. A project team has multiple tasks with dependencies. A task is delayed, but it does not affect the project deadline. How should the project manager handle this delay? A. Add extra resources to speed up the delayed task. B. Adjust the critical path to account for the delay. C. Inform stakeholders about the delay and continue monitoring. D. Skip the delayed task and move to the next task. Answer. Correct answer. C. Inform stakeholders about the delay and continue monitoring. Explanation. If the delay does not affect the overall project timeline, the best approach is to inform stakeholders and continue monitoring progress. Unnecessary adjustments to the critical path or adding resources may not be needed. Question 27. The project manager is evaluating a project's budget. What is the purpose of analyzing the cost performance index, PIA, to identify which tasks are behind schedule? B. To determine the project's profitability. C. To evaluate the cost efficiency of the project. D. To forecast future project costs. Answer. Correct answer. C. To evaluate the cost efficiency of the project. Explanation. CPI. A metric that measures cost efficiency by comparing the earned value of the work performed to the actual cost incurred. E greater than 1 indicates that the project is under budget. Question 20. The project manager is managing a project with numerous interdependent tasks. What is the primary benefit of creating a project network diagram? A. It helps visualize task dependencies. B. It identifies the project's critical path. C. It tracks project progress. D. It sets the project budget. Answer. Correct answer A. It helps visualize task dependencies. Explanation. A project network diagram is a visual representation of tasks and their dependencies, helping to plan the sequence of activities and ensure smooth workflow. Question 29. A project manager needs to integrate a new software tool for task management. The team is not familiar with the tool and training is required. What is the first step the project manager should take? A. Begin training immediately to avoid delays. B. Review the software tool's documentation. C. Assess the team's readiness for learning the new tool. D. Schedule meeting with the vendor. Answer. Correct answer. C. Assess the team's readiness for learning the new tool. Explanation. Before introducing new tool, it is essential to assess the team's readiness and determine what training is needed to ensure smooth transition and avoid delays. Question 30. A project manager is assessing the impact of resource constraints on the project schedule. What tool or technique would help the project manager analyze these impacts? A. Monte Carlo simulation. B. Resource leveling. C. PERT analysis. D. Work breakdown structure. Answer. Correct answer. B. Resource leveling. Explanation. Resource leveling helps to identify and resolve resource conflicts by adjusting the schedule. This technique ensures that resources are not overallocated, which can delay the project.